Good morning, everyone. It's another fantastic Monday morning here at Health Plan Markets. It is July 15th, 9 o'clock on the dot. We're going to start our calls early this time. Moving forward, we want to try to keep on time for everyone, just for all of you folks that got here early and on time. We want to show our respect for you. So thank you very much. As we go through the summer and we're getting ready for certifications, I also want to remind you that if you do have client appointments, or if you have important meetings or rollout sessions or anything else that might be going on that conflicts with this particular meeting, just know that these calls are being recorded and they are hosted on our YouTube channel, and you can go out there and subscribe so that way everybody can get there and watch what's going on. Just in case you miss a video, we don't want you to miss the content, which is most important. So thank you for being here. We are here to improve the lives of our community with affordable healthcare. So thank you for being a part of that mission, and thank you for being on this call. So we've got lots to go through this morning. So I am first start a little bit personal news. I'd like to share that I have added a new family member to the Jacobs family. We now have our daughter Ava, who was born on Tuesday of last week. So I've been out taking care of our brand new daughter. She is healthy. Mom is healthy. And thank you all for the wonderful wishes over the week as we welcome our new daughter into the world. So very, very exciting, and I am very tired. And yes, Ken, I definitely need to get back to work for sure. So here I am. I'm going to take it a little bit easy because Mom still needs my help, of course. And we've got 3 Rugrats now, so it's a lot of work. So thank you for your patience with me. But I also want to remind you guys that I'm not the only one here at Health by Markets. We have an incredible team of people here to support you, and they do that every day. So please don't forget that we've got our 844 number, 844-696-3975. I will put that in the chat, and then always support at askhpm.com, support at askhpm.com, and we're here to help you at any time. So thank you for that. But as we normally start out, it's certification season. I do want to remind everybody that 2025 certifications are out, including AHIP, and AHIP is live. And we also have quite a few certifications rolling out from the carriers, which I'm going to talk about a little bit later. But I also want you to know that there's still live training on the training calendar. To get there, you're going to go to, from your HQ portal system, you're going to go down to learning, and then the HPM training, which will have all of the calendar stuff that we're going to talk about this morning. So this is it here. I just like this view because it's on my calendar, so I'll show you this. This morning at 10 o'clock, those of you in the Tampa market can enjoy Gold Kidney doing a first look session at 10 o'clock at the Oxford Exchange over on West Kennedy. You can check that out this morning. There's still time to catch the bus, train, or plane, or however you're going to get there. Later today, Devoted is doing a turning no into a yes training. It could be just a watch session here. It does look like that. Later today, AARP is doing Medicare sub training, and they're going to be focusing on the high deductible Plan G specifically. It looks like that one is very, very requested. So there you go. Tomorrow, the 16th, Gold Kidney is doing another rollout session, and that is at the living room over on Piazza Avenue, and I have no idea where that is. Let's see, that is in Wesley Chapel. Sorry, so they're doing another one over there on Wesley Chapel. That's Tampa Market, a little bit north in Pasco there. Devoted and Dedicated is doing a marketing training. This is in person for the Central Florida people. It's going to be at the Winter Park Dedicated Senior Medical Center. This is in person. It's a collab between Devoted and Dedicated. So if you're in the Central Florida market and you want an in-person training, that's from 11 to 1 tomorrow. United Healthcare is doing a certification study group at 1 o'clock. You can jump on there and register there as well. Moving over to Wednesday, the 17th, our very own Al Clancy is available for a virtual copy and chat. Anything at all. If you feel lost, confused, have questions, want to share ideas, Al is there for you every Wednesday at 9:30. and he can get you on the right track and feel, just in case you feel like you're in a rut or you're not where you need to be, Al will be there. We've got a Medicare Sub Training 101, and this one's in Spanish. It's for the AARP Medicare Supplement Training in Espanol. So if you know anyone or if you prefer the training in Spanish, there it is at 10 o'clock on Wednesday. Cigna's doing virtual office sessions at 11 on Wednesday, and then our contracting team is available every Wednesday at 11, open office hours. It's virtual, so all you got to do is log in, and you can get all of your contracting certification questions answered between Jessica and Sam. So they make themselves available every Wednesday at 11 o'clock, whatever you might need. Okay. Moving over to Thursday the 18th, Aetna's doing their certification prep. That's at 10 o'clock. United Healthcare conducting a successful event. Now, even though it's certification season, guys, I do want to remind you that it's also lead generation season. It is lead generation season. You cannot get to October 15th and expect leads just to start coming in for you. You need to start cultivating your leads and your lead channels yesterday, today, yesterday, because you can't show up on October 1 and expect your phone to ring. And if you don't have a list of people that said, hey, I do want to talk to you in October, how are you going to make those numbers, right? We're less than 90 days from open enrollment for Medicare and a little bit more for ACA business. But events is how you're going to get the traffic you need to get the leads that you need to be successful in this business in the busy season. You need to start collecting names and phone numbers now, so when season rolls around, you can start making those phone calls, okay? So how do you do a successful event? United Healthcare's training you on Thursday at noon. Mark your calendar for that. Also, they're doing chronic condition plans at 1 o'clock on Thursday. And as always, Al and Gabe are available for their HQ intro, which we're going to talk about again. This is our portal system where everything that you need to be successful at HPM lives in HQ. Thursday, that's Thursday. Friday, the 19th. What about HPM Shop? We're going to have quite a bit of changes on our agreement with Connecture. We've got a lot of new features that will be rolling out on HPM Shop. So if you are not familiar with it, or you need to get familiar with it or more familiar with it, HPM Shop, our quote and enroll tool for Medicare Advantage and supplements, and soon ancillary products we're going to be adding on there. Make sure that you're familiar with our enrollment platform. And Tom has made it a point to be available every Friday at 9:30. It's a one-on-one, it's a coaching session. He's going to walk you through on everything you need to know about Shop and being successful about it. As new features start rolling out, we will also be hosting those training sessions in this calendar event. Okay, so Tom's going to lead the charge on, hey, this is a new feature, this is how it works, this is how you get to it, this is why you need to use it, so on and so forth, as we roll out new features for 2025. So be prepared for that every Friday, 9:30. Also Friday, United Healthcare, get up to speed on Medicare changes. We're going to talk about that today. That is another training at 11 o'clock on Friday. It is in person in the Orlando market in Maitland if you're there. They're also hosting another one, same place, at 1 o'clock, okay? I'm going to give you guys the condensed version this morning on what they're going to talk about specifically in that training, so you don't necessarily have to go on a Friday afternoon. I'm sure there's other fun things you can do, like your AHIP, right? So that's the training for the week. Remember, guys, we got to keep one foot in the classroom and the other one in the field at all times. Okay, that's just how it goes. With that, I do also want to remind you that we have a Health Plan Markets AHIP link available for you. So if you have not yet braved the waters for 2025, our AHIP training link is here. The test is normally $175. Using our link, we'll give you that automatic $50 discount, and the cost of the class is $125. So same thing there. Please log in and use it. As I explained before, we're on the hook for 200 registrants, and we need to accomplish that by the end of next year. So it would be, I would be honored if you use this link. I know it sounds silly, but it's just a link, but it does help us meet our obligation for AHIP. And we want to continue to be able to offer this and not get slammed with any fees, of course. So there it is. The link is in the chat, so make sure you get out there and you do that. Okay, I do want to go through recertification here this morning. So going from HQ, I'm going to go back to the home page here. You can just click the logo up top, and it always will bring you back to this home page here. And under contracting, you'll see recertification 2025. Both Fernando, Gabe, and John have all been organizing this as the recertification instructions have been rolling out. So the AHIP link should be loaded here. So if you need that AHIP link, it's right there as well. But going back here, we are collecting all the information on how to get recertified for each carrier. So if you're looking to get recertified for Aetna for 2025, you'll click the Aetna link here, and it's got all the instructions, the user guide, the video, and everything you need. So you don't have to dig around in your emails on, hey, where's that link for Aetna, and how do I get to it, and what do I got to do? So we are cultivating all of this into one place to make it as easy as possible. Now, some of this information is still forthcoming, so thanks for your patience on that, but check back regularly to ensure that you did get all these certifications done, and we're going to continue to load them up as we get going. As a reminder, if you're new to one of these carriers, this is not where you'll go to begin your certification or your contracting. So if it's the first year that you're like, hey, I want to add Devoted to my portfolio, do not go to recertification because you're not certified now. This is for those folks that are currently certified and need to be recertified. If you want to add Devoted to your portfolio, you're going to want to jump into contracting and select meet with contracting so they can discuss how you can get set up with those particular carriers. Okay, so keep that rolling as we go. Other tools and resources as we're continuing into HQ and building this out. The enrollment tools with HPM Shop is a link out. And the good news for this year I want to share with you is that in previous years, they had set up new URLs for each year, which also mean that you got new pearls, which mean that we had to distribute them to all of you guys, which delayed everything. So this is the first year that we are going to be using the same link, the same login, and the same pearls that you've used last year in 2024. Okay, so there's no need to change URLs. There's no need to change your pearls. Everything will live in one place, and you'll have the ability to swap back and forth between 2024 and 2025. So it should be a lot more efficient for you as an agent as you're moving forward, continuing on your journey to get people enrolled. Okay, so that lives there. Health Sherpa, that link will never change. They've pretty much got that figured out from day one. So you can get that rolling as well. Contracting, I just want to go back up here. If you are interested in getting contracting with any of the carriers for now, please reach out to contracting@askhpm.com, and we can add any carrier that you would like. Just know that if you're currently tied to another FMO, you will need a release letter to get aligned with us on that particular carrier. Those windows are closing very quickly. Most of these carriers have blockout times, which means, hey, no one can do a transfer or get a release until next year. So those blackout dates are coming up for most of the carriers. So please talk to contracting about that. If you have some things in the wind that you'd like to get organized and centralized in one place with HPM, we want to make sure that you've got everything that you need in one place to do your job. So that's the whole goal there. Going down to commissions, we are still adding in the new rates. I'll be working with Liam today on updating the Medicare Advantage rates. ACA commissions for 2025 haven't rolled out yet, but we'll continue to update these as we get them. There is some frequently asked questions. So right now we have the MAPD 2024 rates. We'll be adding the 2025 rates as they've been released already. And we're going to talk a little bit about that this morning as well on the commissions for Medicare specifically. Under marketing, remember that we've got all sorts of great stuff here. I also want to remind you that we have Direct Mailer, a partnership with them for continuous marketing campaigns. Remember at the beginning of the call, I talked about this being lead generation season, meaning that you've got to get out there and generate leads. And if you're struggling with that, you might want to talk to Mike and Jonathan over at Direct Mailer IO. you can click here to learn more. But these are direct mail campaigns that you put on autopilot and your phone rings. So we baked that in because we found extreme value, and we feel that that would be a really great thing for you guys to take advantage of if you haven't already. Please remember that the learning sessions are here. We are going to be rebuilding HPM University. The webinars are here. Monday Call, which you're on right now, is here as well. Other resources, don't forget we've got our Gold Key, Benefits Checkup, and then the Spark platform and all of the Spark Help Center that you might need if you're using the CRM for Spark specifically. So there it is. Now, let's dive into some news today. And outside of the horrible violence that we experienced over the weekend, and thank goodness, some the former president is okay. It's just horrible that those types of things happen in the world. But I am praying that as a society we're getting better at controlling our emotions and the things that we have to do out there. But in our world, the news that goes is I want to bring everybody up to speed with what's going on in CMS specifically. And as you know, there's been quite a few changes, rumors, and things that have happened over the last 9 months about FMOs, agents, and I'm talking specifically about Medicare right now. ACA seems to be somewhat safe at the moment. And CMS has made a lot of these rules and regulations regarding changing compensation and marketing dollars and things like that to prevent steering certain plans only to seniors and allowing them to make an informed decision and, as much as possible, unbiased decision about their health care. So, and just a recap, last year CMS proposed that FMOs were going to go away, and that didn't fly, so that came back. And so we're safe there. We have a job, so that's all good. And then they proposed that they were going to cap commissions to the brokers. Now, as independent agents, most of you are getting paid directly from the carrier, and those amounts vary. But in 2024, a new to Medicare rate would be $611, just as an example here. $611 would be your rate. If you find somebody that's turning 65 in August and you get them enrolled, you'd get paid $611. Now, if you did an HRA form on top of that, some carriers are offering as much as $400 for an HRA fee. So that puts you well over $1,000 for a new to Medicare enrollment. Not to mention maybe partnering with a doctor's office that compensates you for helping set up that first appointment for as much as $300. And so now you're looking at $1,300 for a new to Medicare. And so that's what we call steering, because some agents are saying, hey, look, wow, I can make a lot of money on this. Maybe I'm not doing what I need to be doing for the senior specifically. So CMS is concerned about this. So what they did is they said, look, we're going to go away from HRA fees because we think that that's ludicrous. They feel that that compensation should be included in your commissions. And so they capped the administration fee at $100. So what CMS has lumped this all together is, hey, we're not going to pay for HRA fees anymore. You're not allowed to collect HRA fees. The doctor thing is still alive, which is really still kind of interesting that they haven't come and attacked that yet. But there are certain doctors that are compensating you to help them generate leads. Okay. More on that on another day. But for now, that HRA fee is going away. Carriers are not allowed to control how much money that they pay you for an HRA fee. So they've set the standard, but they also lumped in a bunch of other stuff. So there were certain carriers that were paying you for marketing dollars, and I'm doing this, right? Because I know not all of you are using those dollars for marketing. And then you would get a marketing dollar check directly from the carrier for your production. So the more you sell, the more money you get for marketing, right? So CMS looked at that and they said, hey, look, that's a little vague, and we don't like that. And we don't want to compensate agents based on production from one carrier, because then that leans you into like, hey, if I get more on this particular carrier, then I make more money. So CMS says no more marketing dollars to the agents. Okay, so no more HRA fees, no more marketing dollars. And then what does that look like? Because some of you are doing events, some of you are doing seminars, some of you are spending money on ads and mailers and things like that. You know, how do I make up for these costs, right? So CMS says, okay, well, we'll go ahead and tack on another $100 to your commissions based on the fair market value. And so your 611 now becomes 711. But you can't, there's no more HRA fees, okay? There's no more marketing dollars, and there's no more AHIP reimbursement or any of that stuff starting October 1. That's how the rule currently stands, okay? So just want to give you a recap on the way that it stands now. So with that said, there are several groups, national marketing organizations, that felt that CMS had overstepped their regulations. And so with that, I'm sharing with you on the screen an article, and I'll share the link to this article if you want to read about it, but I'll recap it for you, is that there are several NMAs, national marketing organizations, national marketing associations, that are suing CMS because they have capped compensation to you guys. And when asked about where did you come up with that $100 and how is this fair market value and what is this really worth, CMS did not have an answer. And so that prompted many lawyers to get involved and say, well, this is overregulation from the government and we're going to sue them. And so here we are. So a Texas judge has decided to take on the case. I guess Judge Reed O'Connor is known for taking on government regulation. So they were seeking him out, and they got him, and they shared their case with them, and he took it on. And so he is going after CMS on this overregulation. So what does this mean to you today, and what does it mean to you for the future? So because of this lawsuit, the judge has decided to pause the CMS rule cap compensation on that $100. Okay, so I'll read the brief really quick, and then you guys can read the whole article on your own. But a federal judge has paused the CMS rule capping compensations for brokers that sell Medicare Advantage plans as lawsuits challenging the regulation work their way through the courts. Americans for Beneficiary Choice, an association that represents brokers and the organizations that employ them, and one of its members, sued to stop the rule earlier this year. The order staying the government rule joined ABC's case with a similar action brought by the Council for Medicare Choice and two Texas broker groups also seeking to overturn the compensation caps. Through U.S. District Judge Reed O'Connor's stay is temporary. His decision, published July 3rd, suggests the judge will overturn at least part of the rule. In it, O'Connor argues the CMS didn't properly substantiate their caps on broker payments and restrictions to the terms of contracts between health plans and brokers and agents. Okay, so essentially that $100 is under attack. And they're saying, no, CMS, cannot do away with HRAs. You cannot do away with marketing fees. You cannot just cap each agent for $100 for all the hard work they do, all the gas money that they spend, all the training, all the AHIPs, all of the marketing, and all the stuff that you guys do. They're saying CMS has overstepped their regulation. So what does that mean? As far as it looks right now, it will be business as usual the way it was this year in 2024. We don't know how long this pause is going to last, but we expect it shouldn't impact plan year 2025. It may impact plan year 2026. So we expect to see many of the carriers, the health plans, really put their foot on the gas, if you will, to get in front of you and to uh, incentivize you as much as possible, legally, of course, to sell their plans. So we think that it is going to be a rat race between now and whenever this CMS lawsuit happens and what comes of it. Now, side note here, this is some of this stuff is my opinion, and I'll point out my opinion versus what is actual. So this is actual. I'm letting you know that this article is real and there is real lawsuits happening here. And I have seen where they're going to be pausing it until 2026. But like I said, the thing that is my opinion is I feel that the carriers are going to come hot and heavy. Now I'm seeing some of that already, but I feel when a lot of them start understanding that, hey, look, the model's lifted, we can go ahead and go back to business as usual. I think that, again, my opinion, I think that a lot of these carriers are going to put their foot on the gas and really start spending some cash to get in front of you and potential members. So what does that mean? Well, if you're smart, take advantage of it. Talk to these carriers. If you're selling quite a bit of a certain carrier or so, please make sure that you are connecting with their managers and asking, what opportunities do you have to help me with marketing? What can you do for me? Because I am pumping in hundreds of thousands of dollars worth of business to your organization, right? And you are. I mean, if you're doing, 100 apps a year, I mean, believe it or not, you're bringing in over $1 million worth of compensation to these carriers. I mean, you guys are doing a fantastic job, but they have to turn around and help you. And that's really what this is all about. So I'm really excited to see that people are taking a stance on this and standing up for us as agents and brokers. And it's good for you guys to know what's going on out there. And so I'll keep you posted on what happens here. But again, it looks like it's going to be business as normal. We have seen that these articles have been posted. The judge has posted this, but we haven't seen any official notice from CMS yet. And we don't expect to see it until probably later this month, maybe even early next month. I think they might have been shaken to their core on this because they really didn't have a good answer on why they're capping that $100. So there we go. So Mary's asking, for 2025, are we back to 611 commissions due to the stay in the lawsuit? No, it does look like they released the fair market value for 2025, and I will get you those rates on the next call, Mary, and we will start posting those in HQ. So the commission is fine. What we were discussing here is the $100 HRA cap and the marketing fee cap on that specifically. So no more $100 cap. It's going to go back to how it is now. So, the carriers decide who's going or what they're going to pay for their HRAs, and they can go back to compensating to for marketing dollars and things like that. So, however you've experienced your carrier marketing reimbursement or HRAs as it was in 2025 or in 2023 and 2024, it's going to go forward in 2025. Okay, so it's business as usual because of this lawsuit saying, hey, look, all these new rules, boom, right, there it is. So someone's asking in the chat, so we can make $711 plus $100 plus marketing reimbursement. So it's $611 right now for 2024, and the $100 has gone away. You have HRA fees, and the HRA fees range from $75 up to $400, depending on the carrier. So you actually make a lot more. And then there is marketing reimbursement from certain carriers that have these programs available. So for more information on any of these programs, please get with an HPM manager, or if you're an agency partner, please get with your principal on this. And they can fill you in on, what this compensation looks like, how can you take advantage of it, and making sure that you're understanding how all of these pieces fit together. We want to make sure that, we're delivering this information as best as we can. Great questions, by the way, great questions. And again, the article is in the chat, so you can go ahead and click that, read more. There's quite a few articles about it, actually. I was kind of really surprised to see so many people writing about this because, Medicare is still kind of like a subculture, if you will. But there it is. And with that, I'm going to post our email. Again, if you need anything, any questions, concerns, if you have questions, certifications, recertifications, compensation questions, training, whatever you need, we've got support at askhpm.com. There it is. And then as a reminder, 844-696-3975 is our main line, and we will get somebody to answer the phone, because that's what we do here at Healthline Markets. We answer our phone. Can you believe it? Can you believe it? There's no phone tree here. I love it. Elise is asking, so the CenterWell dedicated senior compensation will not be affected. That is correct. CMS has no guidance on how doctors are compensating for their lead programs. So we have seen, on that note, I do want to make mention that we have seen Dedicated pause their program right now, and CenterWell has paused their program right now, and they're revamping it, and they're doing new trainings because they want to kind of streamline that process. So those of you that are in those programs will need to be recertified, retrained on those programs as well. And what Elisa is alluding to is some of these carriers are offering or some of these doctors' offices are offering as much as $300 for you to work with them and generate leads into their centers. So that's additional compensation that you have. Okay. Awesome. So if you've already done the new training and you got that done, fantastic, way to go. They will let you know the next steps on that. So we are at time. I want to thank everyone so much for being on this call and listening to me yap. I am here to help you guys. So if you have any suggestions for content, if you have any ideas that you want us to talk about, we're back in action. Thank you, Elisa. I am back. It's going to be a little slow for me, so I got to go through about 700 emails from last week. So if I don't respond right away, please forgive me. I'm working through it. So, but remember, if you need something urgent, we've got an incredible team to help you. And don't forget, we've got the email and the phone number there as well. Okay. Thank you, guys. I hope you have a fantastic week, and keep it rolling. You guys are incredible at what you do, and people need your expertise and your charisma. There it is. Thank you, Ramilda. Thank you, Bud. Appreciate it. Thank you, Elisa. You guys have a fantastic week, and we will see you next Monday.